and welcome to Mayu Dentistry. My name's Winona. I'm one of the hygienists here, and I just wanted to give you a quick little overview on what you can expect on your first visit with us. So we love to have new patients, and so when you first come in, you'll be greeted. We do have some paperwork that we need for you to fill out. So it involves a medical history, kind of a dental history. The medical history is important because it lets us be able to know if there's any existing health factors that may affect your care, such as like diabetes, any kind of joint replacement, cancer history, anything like that. So it is important that you fill that out thoroughly and list any medications that you're taking, because prescription medications can have an effect on your oral health. And after all that fun paperwork, we have you come back, we give you a little office tour. And if you haven't seen already, we do have our office tour online. So Dr. Mayu does host that, so she'll bring you around the office. So after the tour, we sit you down, Kelly or I, the other hygienist, and so we basically just kind of get to know you a little bit. We ask you, is there anything in particular that brought you in? Are you having a toothache? Or are you just kind of getting back into a routine? Are you new to the area? That sort of thing. So once we kind of get to know you a little bit, we'll do a full assessment. And so basically it's gathering information about you and your mouth. And so what that entails is we're going to take necessary x-rays. So usually that means we're going to do a full mouth series of x-rays. So it is 18 little pictures that when we put them together, they create basically a roadmap of your mouth. So typically those are done once every 3 to 5 years. We're a little bit more on the conservative side, so we'll kind of plan on every 5 years. That's kind of how we like to do things here. And so those x-rays let us check for cavities. They let us check for infections, cysts, anything out of the ordinary. So it really gives a complete view of your mouth. So they are necessary and very important. So after we get those pictures, we'll do some charting. So we'll look in your mouth. We'll check, what teeth you have, if you're missing any teeth. We mark down any fillings that you may have, crowns, that sort of thing. And then the last thing that we do before doctor comes in is called periodontal charting. And so if you haven't had that done before, basically it's just a quick little, basically a gum exam. So we measure around every tooth. And so we're just checking for any deeper pockets or areas of gum disease that is going to directly affect your course of treatment here with the office. So it takes, I don't know, probably 3 minutes or less. And so we just call out a bunch of numbers, measurements, and then after we do that, we kind of sit with you, kind of tell you what we found, what we're thinking, kind of learn a little bit more about kind of your routine as far as the oral hygiene goes, how often you're brushing, when you're brushing, are you cleaning in between your teeth, that sort of thing. And then we have doctor come in, and she does a thorough, comprehensive exam. And one of the things that she'll ask patients is, are you happy with your smile? And sometimes patients kind of look surprised that she asks that, but I think it's a really important question because a lot of times patients may not know that they have some options, if they aren't happy with their smile. So whether, it could be like older silver fillings that are kind of like showing or shadowing, or maybe, a tooth is a little bit crooked, where, if you ask family and friends, they wouldn't, necessarily notice it. But a lot of people have some, maybe self-conscious issues that we can definitely help with if that be the case. So anyway, it's kind of a fun question, and so yeah, the world of dentistry has tons of options as far as kind of cosmetic, orthodontic, things like that. So basically that is what you can expect at your first visit. I was going to say, depending on those x-rays, that periodontal charting, and the current condition of your mouth. Sometimes we're able to do a normal routine cleaning if everything's nice and healthy, and you've been kind of seeing, a dental office or getting dental care regularly. And then sometimes, if it's been, quite a long time, sometimes we do have to have you come back and we do more of periodontal treatment. And so we'll go over all of that and answer all of your questions if that is the case. So yes, we get a lot done that first appointment, and we don't want to rush. And so that's why sometimes we do have to have you return, but we want to do a great, thorough job for you, and we want you to feel comfortable and kind of get to know you. So I hope that helps on maybe what to expect, and we hope to see you soon. Thanks. Have a great day.